Okay, so we will go ahead and get started. As I was introduced, my name is Mary Huff. I am an ambassador for Dragonfly, which is just a fancy name that we like to give our trained volunteers who deliver our programming. We always like to start with this disclaimer. Dragonfly is not a healthcare providing organization. The information that I'm going to present to you today is not medical advice and does not substitute for speaking to professionals about your own or loved one's care. If you are in crisis right now and need emergency help, we recommend that you disconnect from this presentation and reach out to local emergency services so you can be connected. We also listed on this site some local phone hotlines that you can reach in the event that you need local care. A brief overview of what we're going to discuss today. So I will start out with a Dragonfly Mental Health introduction and delineate what this talk is and isn't about, or what it's meant to be. We're going to touch on what we at Dragonfly call the spectrum of mental health. And the main part is going to be a brief overview of some mental illnesses. We'll focus mostly on mood disorders and anxiety, but we will also briefly touch on burnout, psychosis, substance use disorder, autism spectrum disorder, and obsessive compulsive disorder. I'll emphasize the importance of treatment and prevention through each of these topics. And at the end, we'll discuss any questions you may have, as well as some of the survey responses we received from you all. At that point, you are welcome to submit questions anonymously, or we can unmute, raise your hand and we will get you unmuted if you're comfortable asking those questions with your own voice. As previously mentioned, my name is Mary. I completed my PhD in behavioral neuroscience at the University of Iowa in 2016. Since then, I have been a postdoc, continuing to study learning and memory at the Stowers Institute in Kansas City, Missouri. So any neuroscientists are lingering in the shadows, I'm always happy to chat about my research, but I will actually not be talking about any of that today. I have over 10 years of trainee-led programming and development, which most recently culminated in co-founding a mental health committee at my home institution. Through that process, I was connected to Dragonfly Mental Health and joined on as a volunteer in 2020. Dragonfly Mental Health is a nonprofit organization that was founded in 2019 at iScientist by Dr. Wendy Ingram and Yelena Brasnak. We have three large domains of activity. First, we have a large group of volunteers who are all academics or academic adjacent individuals who work together to conduct research and address systemic issues within academia. So we still often refer to this under the umbrella of the Global Consortium of Academic Mental Health. So you may see Dragonfly sometimes referred to under that name. We also have this worldwide community of academics that care about mental health, both for themselves and for their communities. And we meet in what's called Dragonfly Cafe in a virtual format every Monday, Wednesday, and Friday at, let me do the mental math. It is 11 a.m. Central Daylight Time in the States, which I believe makes it 6 p.m. British Summer Time. But if anyone is interested in that, when we get to Q&A, we'll definitely drop that additional information in there for you. We also develop, deploy, and deliver programs on campus. These include the mental health literacy talk that you will see today, as well as skills workshops and an anti-stigma campaign that aims to create culture and climate changes directly in academic communities. We work to improve knowledge, address culture directly, and build community. No one knows academia like academics. So we want to be those evidence-based solutions delivered by people that we trust. Because we're in a for academics community, here are some familiar faces from our Dragonfly Volunteers. We represent over 15 countries, 25 disciplines, 25 universities and 22 disciplines. And currently our volunteer numbers are about 180. So it's a phenomenally diverse group of people who are really passionate about mental health in academic spaces, and we couldn't do any of this without them. At Dragonfly, we believe the best way to cultivate excellent mental health is to fully prevent and prepare our communities. To this end, Dragonfly has created a model of wellness with 5 domains of excellence. These include departmental or institutional committees and a commitment from those departments or institutions to fully support mental health and wellness. We also recommend peer networks. These can be graduate student or other constituency-based focus groups that at least partially focus on mental health for those specific populations. We know that in order to decrease stigma and increase awareness, we also need to build our skills. So we offer skills workshops in active listening, in mentoring, as well as managing upwards. We also want to increase general awareness for common mental health disorders. We do this through our mental health literacy, as you're all seeing today. And then there at the bottom, we also are fighting to end the stigma that's often associated with mental health disorders. And we do this through interviewing prominent scientists that have welcomed disclosure of their own struggles and often present those in video campaigns. Importantly, these are customized for each community. So if after today you have more questions, more thoughts, want to learn more, please reach out to us. We'd love to assist you in any one of these domains and make sure that your community is getting what it needs. Because as we know, everyone is unique and the situations and struggles that you face may be different than what we're seeing at other institutions or in other departments. So what this talk is and what it isn't. It is a brief mental health introduction. We will emphasize depression and anxiety because mood disorders such as depression and anxiety are the most common, but we'll also discuss other relevant mental illnesses. This is intended to be the beginning of an ongoing conversation about mental health literacy, culture change, and response preparedness. This is just a first step. In order for this to truly benefit your community, we know that we need to continue to build on the information that you're going to see today. This talk is not a comprehensive knowledge or response training. It is not everything that you need to know in a nutshell. And as I previously mentioned, this is not a research talk about my work, but again, I'm always happy to chat with that scientist to scientist if anyone is interested. I'd like to start by setting up the concept that mental health is a wide spectrum. If you are mentally healthy, that's one end of the spectrum. You're doing well, you're resilient to challenges, surprises in your environment, and you're generally okay. One thing that everyone will experience is stress. And stress on this mental health spectrum is characterized by an unexpected event, change that can disrupt your mental health, but it's pretty easy to return to that other end of the spectrum. Distress, however, is when a stressful situation is impacting a person's life that lasts a lot longer than normal than a typical stress, or it's affecting more of their life. Maybe it's something personal that they're not able to compartmentalize, and now it's starting to affect their work. And we may need a little bit more support if we're in distress than we would if it was just a simple stress. While certain interventions like psychotherapy or other coping mechanisms, can help people in distress. Disease is when mental health of an individual has reached a point where a diagnosable condition or psychological, psychiatric, medical intervention is needed to get all the way back to that mentally healthy state. People who have mental health diseases or mental illnesses can operate even if they have chronic diseases such as depression. With good care and an excellent treatment plan, people can maintain mental healthy states the vast majority of the time. And then at the far end of the spectrum is crisis. These are folks who may be experiencing acute psychosis, feelings of wanting to hurt or harm themselves or others. This is something that would need to be addressed immediately. This is an emergent condition and something that a person can handle on their own. Today, we're going to focus mostly on mental disease or mental illness and how we can prevent or treat this state when it arises. So what makes something a disease? Generally, there's 3 pieces that are required in order for something to be diagnosable. First, symptoms have to be consistent for more than a reasonable time. So if we think about the spectrum and we think about stress and distress down to disease, it would be someone who's lingering down in past distress. They're not able to cope. They're not able to do those daily functions in their personal or professional life. This doesn't have to be constant. The language that's often used is more days than not. So in the last 2 weeks, has it been more than 7 days when something like this has happened? And generally, it's longer than 2 weeks, right? If it's However, it's also important to mention that this can last months, right? So someone with a mental health disorder or disease can be ongoing. Oh, and it looks like I said I froze up for just a second. If I continue to have problems, let me know. So the other thing to qualify for a disease is there must be a significant change in a person's normal experience at the onset of this issue. So this would mean that this is something that is not typically occurring in that person's life. And then the third component, and really most important piece here, is that it's going to negatively impact other components of a person's life. So I mentioned this before as just personal and professional, but we can also think of it in the domains of social, occupational, educational. So let's dive into mental diseases. Everything that I'm going to be talking about today is a real biologically and environmentally driven illness. Okay. These can be episodic, they can be chronic, or they can be singular events that happen. All of these are preventable or at a minimum highly treatable. Okay. And we know from epidemiological studies that it is critical to be in a mentally healthy climate and culture and give access to care. So the most common mental health disorders that we see are mood disorders and anxiety. So this is actually a cluster. We have depression, bipolar disorder. Anxiety is highly comorbid, which means it often co-occurs with depression, but it can also exist on its own. Mood disorders underlie 80 to 90% of suicides, which is why we talk so much about increasing awareness as well as increasing prevention and treatment. recent studies have shown that 16% of all people will have major depressive disorder an episode at some point throughout their life. That point prevalence, which means at any given one time, about 6.7 people can have this diagnosis, versus something like bipolar disorder, where there's only a 2.5% lifetime prevalence. So it's very, very low. Many Dragonfly mental health volunteers and ambassadors have been motivated by our own lived experiences or losses. But rather than talk openly about suicide, we have decided to talk about improving mental health literacy, including detection and awareness around mood disorders because of this link to suicides. So the best way is actually to treat the underlying cause. Okay? So if we did a screen of everyone, you'd expect about 6.7% of the people right now to have a diagnosed depression or bipolar disorder. Okay. What's really interesting is that in academic circles, we actually see there's this really big increase. So here's that 6.7 number that I mentioned previously, and we see in academic circles, there is a self-reported increase in this number. So instead of 6.7 of the current population having diagnosed within academics, it's 39%. And it's even higher for anxiety, up to 41%. Okay, so we know the best way to treat this, okay, is other than restricting means and avoiding substance use, right, is to get to the underlying cause. So what do mood disorders look like? You will have a change in mood, again, that's drastically different than the normal case for an individual. There could be changes in their body, behavior, in their thoughts, right? This could be an internal manifestation. What causes mood disorders? Immune and endocrine dysfunction are really big players, right? Our brain is part of our body, and in order to function optimally, we need to be doing things like getting good nutrition, getting enough sleep, exercising, right? Moving our body, even if it's just taking a walk outside when we can. There's also a link to the serotonergic pathway. So we actually know that neurotransmitter levels in our brains can have influence over our mood. There's also a link to genetics, okay, and trauma. So having previous trauma, and you can think of this as what we like to call big T trauma or little t trauma. Big T trauma, accident, large incident. Little t trauma, lots of small things that can accumulate over time and still have a really severe impact on our mental health. However, struggling with or having developed any of these mood disorders does not mean that you're not cut out for academia, okay, or that you're not going to be successful. So our CEO, Wendy Ingram, likes to give this example. Professor Kay Redfield Jamison, who is a professor at Hopkins, and she's one of the world's leading experts on bipolar disorder, and she struggles with the disease herself. She wrote this book that I've listed here at the bottom of the slide called An Unquiet Mind, which is a memoir about her lived experience. So I highly encourage anyone to look that up if you are interested. Somewhat related to mood disorders is something called burnout. So it can be a little confusing when we're talking about burnout because it tends to conceptually overlap with depression. However, the critical piece about burnout is that it is work-related, or you can think of it as being task-related, because we can get burnout not just in an employment setting, but also anytime we have a dedicated task. So something like parenting, right, where we have to get up every day and do specific things. So what does burnout look like? Emotional or physical exhaustion, reduced resilience and adaptability. So when something happens at work, are you able to respond appropriately and do what you need to do? You can get cynical about work, and your colleagues. So unable to have those positive social interactions when you're at your place of appointment. And also reduced performance and concentration. So if you've spent so much time and energy going into this task related event, you may not have the outcome that you want. So how do we help burnout? Chronic stress relating to, what are the causes? So chronic stress relating to work or other ongoing activities, lack of control is huge. So if you are someone who is being given tasks and have no autonomy in deciding which of those tasks take priority or how those tasks get done, then this is a huge predictor of later burnout. Bullying or toxic work environments and relationships, and work-life imbalances. And this is something that has been especially exacerbated by COVID, as many of us are working from home more often. And so there's less of a fine line between when we're supposed to be working and when we're supposed to be having our personal or our home life. So what helps? Taking dedicated breaks for vacation. I know that this can be tricky if you are a PhD student or even a postdoc who may not have dedicated time off that's listed anywhere in a policy, but I would encourage you to negotiate how this could go with a supervisor. So I have to run time points every day for the next 2.5 weeks, but then I'm going to take 3 days where I don't do any bench work. I'll still check my emails maybe. Accommodations or communication. So often we forget that what may seem like an issue to us may not be obvious to other people. So we encourage, especially for work-related burnout, to have those conversations out loud, to tell your supervisor or your colleagues what is going on. This naturally leads to building a support and better network. So once you started to have these conversations, maybe there's a colleague who has a similar issue who can help troubleshoot and figure out what could potentially be done better. And as I mentioned previously with mood disorders, things like sleep and exercise are vital. So if we are not taking care of our physical selves, then our mental health does suffer. So if you are experiencing something that you think may be burnout, we always recommend that you talk to a psychologist or your primary care physician to see if you may need more advanced care and to make sure that you're getting appropriate treatment, whether it is burnout or another mood disorder like depression. So then we will move on to psychosis. So psychosis is a disconnect from reality. It can manifest as bizarre behavior, delusions. So those are thoughts of untrue things, hallucinations, which can be visual or auditory, a chaotic or incoherent speech and writing. Psychosis is rare, but it can be distressing, right? Only 1% of the global population is thought to ever experience psychosis. What are the causes? So there is a huge genetic predisposition to psychosis, and environmental triggers can lead those people who are predisposed into having a psychotic episode. It's especially triggered by things like extreme sleep disturbance. And we know from studies that actually restricting sleep too much can lead to psychotic episodes. It can also be caused by substance use or withdrawal and can accompany other disorders like bipolar mania or borderline personality disorder that within their diagnostic criteria have some psychotic features. Okay. These are usually determined by a psychiatrist and end up being referred to underneath the main diagnosis. A lot of folks, especially people in higher education, or those who might have better coping skills, may really try to hide psychosis or not tell people about it because they're embarrassed or they think that their brain is broken forever. This is not true. Okay. There are excellent treatments, and people can lead very productive and enjoyable lives, even if you have experienced these symptoms. So, what does help? Antipsychotics, psychodynamic therapy, and dialectical behavioral therapy. So these are different approaches to having that social support. Um, Another example of a prominent academic who has been able to live a very successful life as well as career is Professor Ellen Sachs with this book, The Center Cannot Hold. Again, that's a recommendation from our CEO, Wendy Ingram. So substance use disorder is stigmatized like many other mental health disorders. This is problematic because many substances can affect both your mental and your physical health. What does substance use disorder look like? Daily use, binge behavior, blackouts, lying about use, cravings, or use that impacts your work. So this is, again, very similar to mood disorders when you cannot function normally for you in social settings, in work settings, in academic settings, then it could be a diagnosable substance use disorder. So one example that we like to give is that alcohol use disorder can lead to the development of depression. Conversely, we know that if someone is experiencing depressive symptoms, they often try to self-medicate and numb the pain that they're feeling with substances. So this is a two-way street. It can be difficult to disentangle, but they are both treatable and can be treated well together. What causes substance use disorder? Has a heavy genetic component. It's estimated that between 40 and 60%, depending on specific substance of use, can be attributed to genetics. As I mentioned, with alcohol use and depression, it can be a coping behavior or self-medication for someone with potentially another undiagnosed or untreated mental health disorder that someone is maybe too afraid to, doesn't have enough information to go out and get help from a trained medical professional. Substance use disorder can also start from social pressure and just easy access, which can lead to a physical dependence on a specific substance. About 20 Americans a year, 5%, yet only 10% or fewer of those actually seek treatment. However, treatment is available. Detoxification programs, support groups to maintain sobriety. So these social aspects are really important for most mental health disorders, individual or group counseling, as well as peer support. It's also important that we treat any co-occurring mental health disorders, right, to make sure that we are truly understanding what is going on and doing the best for an individual. Obsessive compulsive disorder, also known as OCD. This is when a person has a strong urge to perform certain routines or rituals, what we call a compulsion, unwanted repetitive thoughts or intrusive fears, obsessions. And these patients can spend up to hours a day performing physical or mental rituals, which can lead to avoidance of triggers or people. So this can be really limiting to a person's, again, social, professional, academic lives. Obsessive compulsive disorder has, again, a huge genetic component. There has also been studies that have shown there is a link to trauma, that previous trauma can lead to an increase in OCD behaviors or OCD diagnoses, and there are some brain structural differences. It's relatively rare disorder, even given all those causes. So about 1% of the general population will be diagnosed with OCD at some point throughout their lifetime. However, that does increase to 3.5% if we zero in on the academic population. So for whatever reason, there does seem to be this little uptick in academic settings. But again, there's lots we can do to support someone with obsessive compulsive tendencies or a diagnosable disorder. Things like cognitive behavioral therapy, exposure and response prevention, and medication can all help. And another resource here for anyone that's looking for more information, Dr. Nadine Mueller. Again, this is a recommendation from our CEO and co-founder, Wendy Ingram. So autism spectrum disorder. ASD is a complex developmental condition that involves persistent challenges in social interactions, including speech and nonverbal communication, and has some components of restricted or repetitive conditions. So there's a huge genetic component to autism. When we look at exactly what mutations are occurring, about 25% are novel mutations, and the other 75% tend to be multigenic risk or unknown. So we're not exactly sure. Autism is one of the probably most heavily studied developmental disorders due to having such a huge genetic component. In fact, excuse me. So there are a lot of comorbidities, which means we have a lot of coexisting mental illnesses in autism spectrum disorder as well. So you may have noticed a key symptom is restricted or repetitive behaviors, which may sound a lot like obsessive compulsive disorder. Many people with ASD also have co-diagnoses of depression or ADHD. So what helps? Medication is probably the biggest prescribed to treat the co-occurring mental health disorders: depression, ADHD, OCD, psychotherapy, occupational and educational therapy. So there's a huge sensory component to ASD as well. So occupational therapists can help go in and identify what a sensory trigger may be, whether that's a tactile or a touch trigger, an auditory, a visual, and help those people move into an environment that is more conducive to their success. So a lot of people probably already know about a famous autistic individual and professor, Temple Grandin. And if folks want to learn a little bit more about her and her journey with autism spectrum disorder in moving through academic spaces, Oliver Sacks wrote a book called The Anthropologist on Mars about her and her experiences. There is also a huge following of academics that identify as being autistic on Twitter. So if you are interested, you can follow the hashtag autistics in academia and engage with that community. And we hope that you learn a lot from that. Most importantly, we want to remind you that mental health diseases are highly treatable. About 80% of major depressive episodes respond to standard treatment. Awareness, early identification, early treatments are key. The average person waits 6 to 8 years to seek treatment. That's 6 to 8 years of not getting what they need and not being able to live their personal or professional lives the way that they would like. Untreated mental illnesses can lead to other comorbid disorders, which complicates recovery. So as we mentioned on the substance use disorder slide, if someone has undiagnosed depression that they try to self-medicate with alcohol, that can lead to a substance use disorder, which can delay a treatment response and make treatment a little bit more difficult. Community support and encouragement is highly impactful for seeking care and sustained treatment and ultimately recovering. So here at Dragonfly, you will hear us say again and again, we need our social supports. We need our peer networks. We need like-minded people who understand us and can help us move through these times. So what does mental health look like specifically among academics? So this is data from the Nature postdoc survey that was put out last year. And you can see that postdocs are a little bit unique because they're this gray zone where they're no longer graduate students, but they're not faculty members or even considered full-time staff at many institutions. So there is this culture of long work hours. You see, about 50% of postdocs saying yes, there's long work hours, but only a third saying that they feel like they have good balance at their institutions. Interestingly, a lot of research has been done around IQ and rates of mood disorders. And we see that those with higher IQ and education, so if we just look at years of education without doing any standardized intelligence testing, we see higher rates of mood disorders, and those same people are less likely to seek treatment. But postgraduate education is unique. Okay? Things have changed quite a bit in the last decade and a half since I have been working in academic spaces. We didn't speak a lot about mental health, let alone mental illness. And now at most universities, there are some systems, right? Some things in place, whether that's wellness programs that exist in undergraduate or baccalaureate spaces. But this isn't quite enough, right? We need wellness programs that also are effective for graduate students, postdoctoral fellows, and faculty and administrators. We also know that in postgraduate education, we have some cultural and systemic barriers that make graduate students and faculty less likely to seek support. I'm sure many of you have heard this idea of publish or perish, but that doesn't even begin to scratch the surface of the competitiveness and the stress, okay? But that shouldn't be literal. We should not be decreasing our quality of life or having impacts on our life for our academic purposes, okay? A couple other things that I want to say about this. So don't linger. We know about these other players. We know that even there at UCL, there is a student wellness program, but we at Dragonfly like to think that we are offering something that's slightly different. So we have gone in and really looked at the data and really looked at the culture and tried to figure out what is it about the way that we work that makes us unique and what is it that we need in order to be successful. I think it's also important to note that there is a diversity of experience. So we all walk around in our lives with many identities, and we bring with us to any room that we enter a diversity of experience. Some of these identities are more likely to experience higher rates of depression and anxiety. While everyone is exposed to stress in graduate school, research and academia, different groups may experience more things like harassment, trauma, and bigotry that you may not be aware of if you are not yourself a member of this group. So a few examples. Women, right? We know that typically women are more often targets of sexual harassment and violence. First generation scholars often face economic challenges if they don't have economic support, either from their family of origin or other chosen family. People of color, okay? racism, discrimination. Again, we have seen global rises in diversity, equity, and inclusion efforts, but we still have a lot of challenges that we need to examine. International students, so those who are doing their studies or have taken full-time employment outside of their country of origin, will face cultural differences, language barriers, which may make their jobs more difficult or may make access to mental health care more difficult. We also know that members of the LGBTQIA+ community can face marginalization, bigotry, homophobia, and other issues. And the issue is, when people belong to more than one of these groups, the stresses and risks combined, often with an additive negative impact, which means that if you are someone who is at the intersection of many of these marginalized identities, your ability to be successful is even more difficult, right? And we need to make sure that we are keeping this in mind and doing what we can to first have some awareness about the diversity of experience, but then make spaces where representatives from any of these communities feels safe and feels like they're getting what they need. So one of the comparisons we like to make is between elite athletes and academics. The best athletes in the world train incredibly hard. They give their best to achieve peak performance on the field or on the court. But when there's an injury, even if it's a small one, the response is immediate to address it, right? Even courtside in front of the entire world. So we're privileged enough to be able to use our minds at the highest level as scientists, as researchers, as academics. So when our mind, the most critical instrument for our work, is injured or strained, we tend to just keep what we're doing, okay? And as I previously mentioned, some studies show that people who don't get help right away, on average, then wait 6 to 8 years before seeking help. So we at Dragonfly would like to encourage everyone to treat your mind just like you would treat the rest of your body. If you want to continue to be able to use your mind to its fullest capacity, then even when we face these small bumps, these distresses, even if we don't get to disease, to seek out support and professional care as necessary. So there are a variety of sites you can go look to. I have listed here a few, and as we get talking, I can drop these in the chat. Specifically, there have been some free courses, so things like Coursera that have put out courses on how to deal with your mental health during COVID-19 and a lot of the isolation that we have faced. At Dragonfly First Aid, we also recommend this one down here at the bottom, Psychological First Aid. This was made by a group of academics at Johns Hopkins. It suggests that we treat mental health crises in a very similar way that we would to something like a natural disaster, so that our response, both the level of response, the immediacy of response, and the willingness to bring resources to those environments is just as large as it would be for a natural disaster. So some local and institutional resources that were provided by Cornelia and Abby. As I mentioned, UCL does have a student support and well-being office. So they have the phone numbers listed there. And I did poke around the website a little bit more. It looks like they have a host of resources. So I would encourage you, actually, even if you're not a student, to reach out to them and see what resources they provide. If not for yourself, then for those students that you may be interacting with on a daily basis. NIH also has a mental health helpline finder. So you go to this website and you can put in your age, your location, and some other information, and it will actually connect you with a mental health helpline that is a bit unique to your identity. Before we get to general discussion, I want to thank all of you who participated in the pre-program survey. I did pull a couple of the responses that I think are really interesting and can hopefully guide us in our discussion here in these last few minutes. So first of all, I was happy to see that most of you, if not many of you, agreed that mental health illnesses were a treatable mental disease even before you joined us for our program today. After that response, we asked you, what are some of the things that might prevent you or a loved one from seeking care? And by and large, the most frequent response was, I'm ashamed, or that there is a stigma, that I'm not sure what other people are going to think about me getting care. So from Dragonfly Mental Health, we want to say that we are sorry that you feel that way, and that we hope that having this information, knowing that there are treatment and prevention options for all of these diseases and disorders, can give you that confidence that you need to start to have these conversations, even if it's just with a colleague or a loved one, before you're ready to reach out and take that next step. Another common concern that we got in the survey was time. I don't have enough time to support my mental health because I have all of these other responsibilities personally and professionally. I hope after going through all of this information today that you can see how important it is to prioritize taking those little breaks at a minimum to really help your mental health. So, one of the things that I didn't mention today that we sometimes mention with our burnout information is using the Pomodoro effect. So, actually setting a timer and working for 25 minutes and then taking a dedicated 5 minutes to get up, get out of your workspace. And this might be especially helpful for any of you who are still doing the majority of your work from home and are feeling that blending together of our personal and our professional responsibilities. There are some apps and other tools that you can use to help, but you can also just use a simple timer on your lab bench, on your cell phone, to say, okay, I'm going to work on this specific project for 25 minutes and then take a dedicated break for 5 minutes. Maybe I'll go get a tea or talk to a colleague. And then when those 5 minutes are up, I need to come back to my work. One of the other interesting things that came out of the survey results was looking at the impact of COVID-19 on mental health. So by and large, COVID-19 has had a negative impact on our mental health. This is not surprising. And actually, work at UCL that was done last summer saw that the most impacted age group from COVID-19 were those 18 to 29-year-olds. So you can think of this as your graduate student and your postdoc populations, right? We saw the largest increases in self-reported depression and anxiety in our younger populations. So what do we think is causing this? Lack of physical contact with other family members, friends, colleagues. As we come in and out of lockdown and other types of isolation, we know that this is an issue. Okay? Again, working from home, some people may have faced temporary unemployment due to changing financial landscapes. Many wet labs completely shut down research activities during COVID-19. I can speak, I am one of those individuals who was unable to collect new data for many, many months due to COVID-19 restrictions. There's uncertainty of future. We talk a lot in academic spaces about academic timelines and restrictions, but if you were unable to meet those goals at the same rate, we may be fearful of the ongoing repercussions. And there's also other social demands that have come with changes. So potentially some of you have been homeschooling children and so have had to even further split your time. So we just went to, again, a Dragonfly say that we know that all of these have been issues, but again, there are things that you can do to support. So reach out to your networks. As you start to move back into workspaces, into lab spaces, we encourage you to have these open conversations with your colleagues, with your supervisors, in order to better understand where everyone is at and maybe even figure out some accommodations. So with that, I will say thank you. Thank you for allowing Dragonfly to work with you all. Thank you for allowing me to be here. Over on the left-hand side, I have put contact information for Dragonfly as an organization. We are on all types of social media. You can also find us on our website, which is just dragonflymentalhealth.com. I am also on LinkedIn, Twitter, or you can find me on my personal website if anyone wants to chat further. We welcome you to Dragonfly Cafe every Monday, Wednesday, and Friday in the evenings, as well as to join us as a volunteer if you are someone who is passionate about mental health and well-being in academic spaces. We have multiple working groups and multiple forms of input that we can all work together. So with that, I do have time for questions. If anyone has anything that they want to say, again, feel free to drop it in the chat, or you can raise your hand and unmute yourself. Thank you very much.